and I am the OET hero from the Philippines. I chose OET because of how the structure of the exam was made and how it really fits candidates, most especially the healthcare workers. I prepared for my OET through an OET premium providers. It was a privilege and a great honor to be a part of it and to be trained by the OET premium providers. They honed me on my English communication skills for me to be prepared to take the exam. So just go and enroll yourself to an OET premium provider so that you can ace the examination in just one take. I chose the computer-based examination because almost all of the people are actually using computer nowadays. I really grabbed that opportunity because I think that will help me a lot as well, not just relying on the paper base. Well, to be honest, I took OET because I want to work overseas. So in a month, you can go to the UK afterwards just by processing your papers. And if you want to go and work for overseas, there's an OET behind you that's willing to help you. Being an OET hero helped me and opened a lot of opportunities for me. It gives me the opportunity as well to inspire other people. And I think the best part of living is when you inspire someone. I would definitely say that OET is the most perfect exam for any healthcare providers. Go for that dream and aim for it.
Right, so welcome to another episode of NEAC's Roadmap Program webinar series. I'm your host, Richelle, for today. And right now, we are virtually exploring Africa. And this webinar is all about how African medical professionals can benefit from these global opportunities, why getting licensed internationally and early preparation is important, why international employers, especially in the US, are looking to hire more Africans, and what challenges employers experience when hiring Africans and the solution. And of course, we will also explore how our Philippine institution and us, NEAC, can help bridge the gap. One of the aspirations of our roadmap program is to bring guidance to medical professionals wherever you are in the world. We bring you the experts and industry leaders to empower and prepare you for a global career. We also have explored opportunities in the last webinars, including the US and the GCC. And this time, it's time for Africa.
Opportunities for healthcare professionals are not limited by borders, but reaching those opportunities requires the right guidance, the right preparation, and the right partner. For 19 years, NEAC has been trusted by medical professionals around the world. NEAC, the pioneer in revolutionizing how nurses take NCLEX exams, providing reliable support in international licensing applications, helping more than 100,000 nurses and healthcare workers move closer to their global career goals. From choosing the right state and country, to understanding licensing requirements, and to preparing for international exams, to processing international medical license, NEAC continues to guide professionals every step of the way. Get internationally licensed today with NEAC.
Hi, this is Alvi Akman, founder and CEO of NEAC. I'm very proud today to announce a new initiative, which we call Roadmap Program. What is Roadmap Program? It is a program, a web series program to help you with your international career path. Now, you have either graduated or about to graduate, or you are even working in the medical environment already. So either way, if you are starting your path to get licensed internationally and find your job overseas. This process is a long and complex and confusing path. With our about 20 years of experience, helping more than 100,000 applicants, we have the experience to share with you how can you walk on this path safely, most efficient, without making mistakes, and reaching your goal the fastest and safest way you can. So for that purposes, we prepared this program. We also understand how difficult it is to make certain decisions. You need to be educated about a lot of things to be able to decide. If you don't have the information, how can you make a decision, right? So, for example, which country you should be applying? What's the best option for you nowadays, considering the changing political environment and everything else? If you want to go Middle East, which Middle East country is the best for you right now? If you want to go United States, which state? Are you just going to go apply to a state that your friends applied? Or are you going to apply to a state that's the cheapest or fastest? Or are you going to make an educated decision about what state to apply? So to be able to make these decisions, you need more information. And that's what our roadmap program is all about. We want to help you to understand the whole international career path and empower you with providing as much information as we can so that you can make educated decisions and reach your goal faster, efficiently, safely, and without any redundancy applying to a state that you shouldn't be applying and then needing to spend again money to endorse and get licensed in the other state. Now, the program we prepared will bring together licensing experts, nursing institutions, review centers, and career coaches. So you're going to benefit from all these free of charge. Follow our program, don't miss it. And the first program we're going to start with will be focusing on nurses. We call that RN Launchpad. We're going to start with that. I'm sure you're going to immensely benefit from it. So let's enjoy it.
All right. So for those who have been following this program, stay tuned for the code at the end of this webinar. And for those who are new here, you can check our previous episodes on our YouTube channel. Each time you watch a webinar episode, you can earn a stamp which you will collect through your digital roadmap passport. By the end of this session, those who completed the stamps will win an exclusive roadmap kit that has the ebook, exclusive discount vouchers from NEAC and partner institutions, certificate of completion, free assessment, and more. Just the ebook alone is a must-have. So check our YouTube channel, it's NEAC Medical Exams Application Center, and check roadmap programs on the playlist. And now I'm give you Miss Connie for a quick oversight on Africa in global healthcare. Miss Connie?
Hi everyone, I'm Connie and I am NEAC licensing expert for 9 years. For many years, the Philippines has been the world's leading supplier of internationally educated nurses. In fact, the Philippines also become an important destination for international medical education, attracting students from across Asia, Middle East, and Africa. A growing number of African students are choosing Philippines institution to pursue medicine, nursing, and other healthcare programs because of English medium instruction, internationally recognized curricula, and affordable education. And of course, it is easy to take the NCLEX. We have a lot of NCLEX applicants from the African continent. We noticed the advantages and challenges. That's why we thought, why not dedicate a webinar for them? We believe there is a potential for Africa to become one of the reliable contributors to the global healthcare workforce because African healthcare professionals already possesses the talents, clinical skills, and resilience that employers value, and most importantly, the retrogression advantage. As of 2026, there is no Africa-wide employment-based visa retrogression for nurses comparable to what applicants from India or the Philippines have experienced. Employment-based visa availability is determined by the applicant country of chargeability, usually the country of birth, and the monthly US visa bulletin, not by continent alone. The countries specifically highlighted for employment-based retrogression in recent visa bulletins are India, China, and in some instances, the Philippines, not African countries as a whole. So what this means for many African countries, employment-based visa queues have generally been shorter than those for African countries with very highly demand, such as India and the Philippines. So many applicants fall under the rest of world category, which has historically experienced less severe backlogs, although this can change as demand changes. This can also translate into potential faster visa availability, but it is not guaranteed and depends on the current visa bulletin. This is why many employers from the United States are looking to hire medical professionals from Africa. And this is where early preparation becomes crucial. Many international employers prioritize candidates who have already completed key licensing requirements, such as passing the NCLEX, completing credential evaluation, and meeting English language requirements, as it demonstrates readiness and can make candidates more competitive regardless of their years of clinical experience. While some employers partner with recruitment agencies that support candidates through the licensing process after a job offer, this approach carries risk. If a candidate is unable to complete the required examination within the expected time frame, the recruitment process may be delayed or discontinued. Over time, this can affect an agency's ability to consistently meet an employer's hiring expectations. This is why preparation is really a key. In the next session, our award-winning speaker will talk about why early preparation matters. Now, I'm giving back the floor to Trishelle.
All right, so thank you for that, Miss Connie. We will see you again in a bit. So, nurses, stay tuned for Connie as she will share with you the key on how to get a priority lane for international journey. And now, let me present to you our award-winning speaker who will give us a deep dive into our topic, Africa in Global Healthcare, Preparing Medical Professionals for International Opportunities. She just gave a speech at the Royal College of Nursing Congress in the presence of thousands of nurses and BBC News. She is a Director of Operations and Strategy of Innovate Health Africa, a registered nurse in the USA, United Kingdom, and Nigeria, and holds an MBA. She has been listed as one of the top 25 African women of impact, a digital, global, and public healthcare expert. Please welcome Ms. Faridat Ibidun.
Hi, everyone. Thank you so much for the introduction. And I'm very delighted to be here today. So I'm going to be sharing my screen. Just give me 1 second. Can you confirm you can see my screen?
Yes, Miss Faridat, we see your screen now.
Okay. So, good afternoon. I know it's afternoon in the Philippines. It's just 8:24 a.m. here in the UK. So, good afternoon, good morning from wherever you could hear me from. So, I've always believed that there is a specific moment that changes everything for healthcare professionals who are trying to work internationally. And I know that it's that moment when you realize that being good at your job and being paperwork compliant are not the same thing. And if you have not had that moment, I'm going to be talking about that because I know that we've got nurses here, we have doctors, we have different healthcare professionals who are sitting on solid clinical licenses, years of clinical experiences, you know how to do the work. But what you don't know yet is how to translate that into an international opportunity. And that gap is exactly what I'll be talking about. So, my name is Faridat Ibidun. I won't dive into my introduction because I've already been introduced. So, I'm just going to delve straight into the topic. I'm going to be sharing my knowledge on African in global healthcare and how to prepare medical professionals in international career opportunities. And this is my journey, as you could see. But when people hear that I have like a Nigerian, UK, and US nursing licenses, they think I woke up one morning and collected them like Pokemon cards. I wish it worked that way. Regulators don't hand out licenses because they admire your ambition, your vision board, or your very inspiring LinkedIn caption. They hand out those licenses because you've passed an exam that made you question your own competency at 2 in the morning. Ask me about the night before the NCLEX. Actually, don't, because it's an experience that got me to where I am today. I'm grateful for that journey. I started my Nigerian education nursing journey, and a year after I relocated to the UK. And about a year and 2 years, I started my United States licensure process as well. And about 3 months ago, I've just started my Canadian process, which I've submitted all the paperwork required. I'm just waiting for my license, which I should have that before the end of July. So over the span of like 4 years, I've been able to get registered in almost 4 countries now: Nigeria, UK, US, and I'll be getting my Canadian license as well. And I'll be sharing some of my lessons from that journey, how I was able to maximize the opportunities, the time, how I was able to navigate some constraints. So I'm going to be dividing this topic into four main questions. And the first question will be, just a second. Why are African nurses in demand and what really stopped them from getting hired? So the NHS, which is the UK healthcare system, the public and private hospitals in Germany, the UAE, Qatar, Dubai, the United States, every of these countries have all launched what we call aggressive recruitment campaigns into Africa. And the reason is not complicated at all. Europe and the US, for example, they are staring down at what people call a ticking time bomb, a projected shortage of 10 million healthcare workers globally by 2030. And Germany alone has a target of recruiting about 500,000 nurses from Africa alone just to manage its aging population. And from where they are sitting, it looks like we are a nice to have, population. Maybe not entirely true. We are to an extent, but the main reason driving this recruitment of healthcare professionals from Africa is because we are the solution to a problem that their own training pipelines cannot fix fast enough. And it's cheaper for them because training a nurse domestically take years, it takes a lot of money. But recruiting one who has already been trained somewhere else is faster and also significantly less expensive for them. Even the UK built an entire visa category, the health and care worker visa specifically, just to make that process easier. And also for these Western employers, like I said, it's very cheap and faster for them to recruit from Africa. And there's also the push from our side, which nearly a million trained Africa healthcare workers were unemployed in 2024. And despite the shortages back home, the World Health Organization also put unemployment among qualified care professionals to be around 27%. And for nurses specifically, it's somewhere between 26 and 33% across sub-Saharan Africa. So we've got shortage on one side, surplus on the other, and the English language training that also mirrors closely to the Western model. So it's not a mystery why the pipeline exists. If you do the mathematics as well, the promise of better pay, safety, and career progression of the West also ensures that there's a steady stream of applicants for them. And we another reason why we are also highly in demand is also because of our resilience. There is a saying that Africans can survive everywhere, anywhere in the world. And I used to sort of hear that as a kind of comfort zone or comfort phrase. But now I hear it as a fact with receipt, because when you think about what we've already navigated as Africans, political instability that would paralyze most institutions, healthcare system, that's held together by improvising rather than infrastructure. We are very good at improvising in Africa. Resource scarcity that forces you to become an expert at sort of doing more with less, and that is not a personality trait, that is a learned competency. That is what we have to adapt to back home. We are forged in conditions that most people never have to survive. So when a Western employer describe African nurses as resilient or adaptable, what they're actually describing is somebody who has already proven that they can deliver safe care under conditions that most of their domestic staff have never faced. And that's not a soft skill, that's a hard one, clinical maturity. And we are also like a ready to work talent for them, in terms of the fact that employers love the fact that we arrive already trained. It means that the destination country get a skilled professional without having to pay a cent toward their education, which is efficient for them. A real measurable drain on the country that actually trained us. But that's just the economics of it, and we should say it plainly. But here's what never gets said. The training itself is genuinely rigorous. A nursing bachelor degree in Nigeria or Ghana or Kenya or Zimbabwe runs at least 4 to 5 years. You know, if you are in Nigeria, you even have to do additional 1 year of service, then additional 1 year of experience. So we are talking about 7 years for you to get a nursing bachelor degree, which is very rigorous and heavy with clinical placement that is built from year one. And that is not a shortcut credential, that is a demanding generalist training that produces healthcare professionals that are capable of working across multiple specialties. Even the medicine training in these African countries is at least 7 years, coupled with also other experiences. So it's a training that is capable of producing healthcare professionals that can work across multiple specialties, like not just confined to one narrow lane. You graduate broadly, we are trainable, clinically versatile, and that curriculum genuinely rivals Western programming rigor. It just never get framed that way. We also have our English fluency and compatibility. Like I said, medical education in many African nations is conducted in English and follows curriculum which are quite similar to the Western models, which makes it very smooth compared to non-English speaking regions. And we also have, despite all of the demands that I've talked about that made all of these employers wanting to recruit from Africa, we have challenges. Hiring is still complicated, and not for the reason that have anything to do with our own competency, We have the ethical and political barriers, which is the WHO Red List. Employers face significant ethical backlash for recruiting from red list countries, nations with critical workforce shortages, which also include some of the African countries. So the WHO and other bodies, they've strengthened code of practice to discourage active recruitment from these vulnerable systems, through loopholes. Like in the UK, they've strengthened agency-based hiring. Like, so most applicants have to get their job directly from the NHS system instead of the way it used to be, where you could just be approached by an agency and they'll manage the end-to-end process. They make the whole process easier for you. But now you have to approach this hospital yourself, because that's the WHO code of conduct, which has really affected recruitment a lot. I'll be touching on that briefly when I'm sharing my own personal experiences. There is also the diplomatic tension, between African governments and Western recruiters. African nations have some African nations have called for compensation for the training cost of their immigrating workforce. They are sort of viewing current recruitment practices as a form of new colonialism, which is like a systemic theft of human capital. We also have other bureaucracy and regulatory hurdles like the credential recognition, which is a major pain point, because African doctor and nurses and other healthcare professionals, they often face this expensive process to have the recognition recognized. Many are forced to work below their skill level. I know nurses and doctors that have moved to these countries working as an healthcare assistant because they couldn't get their credentials evaluated, or they couldn't get their license right on spot. And these nurses have like 10, 15 years of experience. They've run ward understaffed, they've managed emergency with have the equipment that they needed, and on paper in a UK or a US hiring system, none of those experiences count until you've actually sat an exam, that is designed for somebody straight out of nursing school. And it's not that the experience does not matter. It's just that the experience is not what is being tested. NCLEX is not asking you how many people that you kept alive under prayer. It's asking you whether you can answer a very broad kind of multiple choice question in a very specific format that most of us have never seen before in our training. So we end up with this strange gap. The most capable people I know are sometimes the one who takes the longest to get license and broad. And it's not because they are not ready, it's because ready to practice and ready to pass exams are two completely different things. And that gap is real. And even getting to sit that, the exam also has its own obstacle. For example, for the US NCLEX exams, the only Pearson VUE testing center on the entire continent used to be South Africa, until recently that we've just secured another one. So nurses from Ghana, Nigeria, and all of Zimbabwe, different African countries have to travel, just to take a test. And don't even get me started on the visa processing, which remains a significant bottleneck. Visa delays and complex immigration rules as stall recruitment for months or years, which could cause stress not only even for the employee, but also for the employer, the candidate as well. Like for example, to get a work visa, you have to have passed the NCLEX, right? But if there is no local center, sitting the exam might mean that you have to get a visitor visa if you want to go outside of the continent to write the exam. And the visitor visa can get denied because the consular offices, they assume that you're a flight risk, because you are stuck trying to prove that you're not trying to stay there illegally. You have to have like a main reason for you to come back home, which also adds to the whole process. And I'll be going to my next slide, where I'm going to be sharing some of the lessons from my personal experiences. And it will answer the second question of what must African healthcare workers do to prepare and why it matters. So I'm going to start with a personal lesson from my journey, and I think one lesson I learned early enough in my career as a registered nurse is to start before you think you are ready. I know that sounds simple, but it's not. Like start the credentialing, the conversation years before you plan to move. Like if you are planning to move in 2027 or 2028, you should be starting, you should be preparing by now. You know, for me, before I even finished my final year nursing school, I already had my international passport application. I started my English language exams alongside my final year nursing exams. And so I had already started researching what the process looks like, different pathway, especially for somebody in my field who wanted to work in like the different countries, what are the options available for me. So I didn't wait before I graduate. I did not wait before I get a job. I started the groundwork while I was still a student because I knew early enough that the process can take time. And sometimes the people who arrive fattest are the people who have started preparing earliest. So that made it feasible for me to relocate to the UK almost a year after I graduated. I was already on a flight to the UK. And here's the thing, that also did not happen because I was lucky or brilliant or exceptional. It happened because I treated the whole move like a project with a timeline. It was not like a dream that I was feeling ready for. And another thing I would also want to talk about is that um there is a window for timing on this, and that window closes fast. So when I graduated, the WHO red list existed, but it was not the same as it is today. So I applied, I started my exams while the policy environment was sort of one way. But nurses that were graduating 1 or 2 years after me, they walk into a completely different landscape. The WHO updated its criteria, countries changed status on the list, the rules of the game shifted, destination countries, tighten their rules. And my second lesson for you here will be to take the opportunity in front of you, not the one you planned. And sometimes that can come across harsh, like you all have dreams, you all have plans, you have a destination country you want to go. But sometimes you have to take the plan before you, and then plan, and then when you get to that country you can easily plan for your dream country. For me, I had a plan. My plan, I did introduce myself that I'm from the UK, but I'm actually specifically from a small island called the Isle of Man, which is the British Crown dependency area, which is not centrally in the UK. So my original plan was to go to the UK specifically. I even had like cities I wanted to go. I had a target, and then the recruiter that was recruiting then only had opportunities for the Isle of Man. So which was the most available option for me. And I took it, and trust me, about a month after I arrived, international nursing recruitment to the UK was significantly restricted. That was when the WHO um red list even got more enforced, and colleagues of mine that were waiting for the right opportunity then, they were waiting for the bigger city, the more familiar places, they found themselves stuck. Some of them are still back home now, years later, waiting. And I genuinely ask myself sometimes that if I've head out for the perfect plan instead of moving when the door was opened, would I still be at home by now? I don't know, but what I do know is that the rules change within weeks of my arrival, not years, weeks. So visa pathway opens and close. What's possible for you today may not be possible for somebody that is graduating next year. So if you ask me the best time to start this process, that was yesterday. The second best time is now, not eventually, not when things settle down, not when things don't settle down. Because things shift, things tighten, things evolve. Every year you wait, the rules could have changed twice. You could have lost a pathway you didn't know you had. You could have lost a pathway that could have made things easier for you. So start now before you lose the window. And here's something I also want to leave with you. Wherever your first opportunity lands you, it's not the finish line. Just like I said, my UK registration didn't trap me in the UK. It sort of became the base I built my US and Canadian registration from. So every credential makes the next one easier to get for me. Every country that you are registered in currently expands the territory that is available to you. So it sort of compound in terms of that for me was having the financial ability to write the exam because I was already earning in pounds in the UK. I already had UK experiences. So it made a significant difference to how I was able to get my US license, and even my US license also made it to be easier for me to get my Canadian license, because for both US and Canada, you need NCLEX. So because I already wrote NCLEX for US, I didn't have to submit a lot of things for Canada. It was quite straightforward because I already wrote the main exams. So every of this country that you do, it opens a lot of different options for you. And another preparation team is also to budget for hidden costs. Exam fees are one of the are like they are the feasible number that we know, right? But other costs like traveling to a testing center, English proficiency retakes. I know people that have written IELTS exams or OET exams several times, before they could able to pass it. So add all of those costs into your budget because those costs add up faster than you could expect. Another point I would want to make is also for you to build a paper trail as you go. So when I started my own journey, I created like a Google Doc where all of my portfolio, like my CV, my resume, transcript, verification letter, my CPD, like very detailed clinical log, my references were just in one place, my passport. It made it easier for me to constantly document, add to it, because many applicants can lose months because they didn't keep records, like that the employer or the regulator will expect. So don't wait until you are being asked for them. Start building a paper trail across all of your evidences as you go along. Update them, and also mentally prepare for a multi-year process. I know that this process can be incredibly long, especially for certain countries. But I do know that the nurses who quit are not the one who lack the ability. Sometimes they are the one that they know that it will take this long to get to that, and then they burn out in the whole process. And it can be very exhausting to wait, especially if there are delays with visa. I have been there myself. So hang on, be patient, stay true to the process because trust me, it will eventually be over. Which is why, again, it is very important for you to start now, for you to start early. And another bonus point that is not on this slide that I would love to add is to upskill in healthcare technology and electronic health record. Get comfortable with digital healthcare systems. We're in a digital world, and employer increasingly values people who can confidently work in digital systems. So, as you all know, Western hospitals are entirely digitized. Africans, we are still catching up with digital transformation. So, if you've never touched an electronic health record before, that's a gap. So try to close it before you arrive, but that doesn't mean that you would not get trained in your host hospitals. But if you can get exposed to it while you are still in your own country, you could also get it so as to sell yourself that you've got digital competency. You can use some of these tools as well. And my next slide will be to answer the third question, which is what are the specific licenses or credentials that let you on board with these employers right away? I've mentioned some of these as I was talking about the processes, but some of it you might be familiar with it already, starting with the language exams. You know, employers cannot legally sponsor a visa without a proof of language proficiency. So passing this early makes you very highly attractive. We have the IELTS and the OET. Most successful healthcare professionals choose the OET over IELTS, because the OET uses like medical scenarios, so it is easier for medical professionals to pass that compared to IELTS, which is just general. But also IELTS is also much more cheaper, so it depends on your pulse or your ability. And before any of these exams could also be taken, or why you write your language exams, your licensing, that's your local license must also be verified as authentic and comparable to Western education, which is the bedrock of all of this preparation. This is where credential evaluation comes in. So an employer will not invest thousands of dollars in a visa for an healthcare professional who has not proven that they can't pass the local licensing exams. So passing one of these exams will make you hireable, like attractive. So you have to evaluate your credential. You can use any of the existing credential bodies. There is the CGFNS, which is also known as True Merit, where for the United States, for example, the healthcare professional will submit their university transcripts to the evaluator, and then they will look at it from their own point. They will look at your basic core clinical hours. If the transcript shows like distinct hours for like all of the courses like medical, surgical, pediatric, psychiatric, you could easily get a green light to sit for the exams. And if there is any gap, they will let you know and tell you how to bridge those gaps. For the US, there is the NCLEX exam, which you have to have sat and pass the NCLEX exam. You know, again, once you have passed this exam, it makes it very easy for agencies or hospitals to actively recruit or hire you, because the primary immigration barrier has been cleared. For the UK, we have the UK NMC portal. So for the UK, do not have to set up an account on the NMC online portal. You have to upload your qualifications for initial verification. The UK also uses a two-part test, meaning that you have to write a CBT in your local country, and then you have to write the part two of the test in the UK, which is called the OSCE. So, but most often, when you already have like your part one, that's the CBT, you can be hired easily. But nowadays, because of the immigration and the difficulty in visa processes, it has been very difficult for even nurses or doctors or other healthcare professionals that already have their full licenses. So for nurses, for example, I have friends who have to travel all the way to the UK to write their second part, that's the OSCE exam, so that they can become fully UK registered nurses, because it also expands their options in terms of opportunities. They can search for job while they are still in the UK before coming back to their country. So it has been increasingly, every day you wait, every day it gets harder. The opportunities becomes narrower, which again also feed back to the fact that the best time to actually start this process was yesterday. But again, the second best time is today. So another thing on the list is the basic clinical experience. So even after you've passed the basics exams, for you to get a job, you still have to have some experiences. Western employer, they look for like basic baseline clinical settings. Like almost all international contracts require a minimum of 1 to 2 years of continuous recent bedside experience, especially in an acute care. And for on-demand ward, we have the ICU. If you are a healthcare professionals who especially work in ICU, critical care, general medical or surgical ward, you have the edge, because most of these countries are looking for nurses with this particular skill set. And just to finish this off on these questions, I believe that strategic preparation matters because it helps you secure the highest style of compensation. You know, when you come to the table with all of these credentials, you've passed your exams, it give you the leverage to negotiate better relocation packages, better sign-on bonuses, you know, higher starting hourly wages. It also shield you against exploitation as well, you know, and it's also cost onboarding timelines. Like if you are already NCLEX passed or you've cleared the UKCBT exams or your specific licensing exams, it will bypass the longest part of the recruitment pipeline, and the employer will prioritize sponsoring visa for candidates who can already step into the clinical floor almost immediately. And the last question here is, what makes African professionals world-class talents? So, like all of you here, you know, could have wondered, when I was talking about what makes us in demand, I talked about different reasons why Western employers still want to employ African nurses. I would also want to talk about our unique combination of like our clinical grades, adaptability, specialized skill set that makes us high performing in in these systems, like starting with our advanced clinical acumen, because most of us trained in resource constrained environments. You know, we trained in environments where we have to manage things, we have to improvise a lot. So we tend to develop extraordinary clinical ICs, advanced physical assessment skills, you know, strong diagnostic intuition, which translates in these Western settings to an ability to detect patient deterioration faster than your peers. Like I said also that we are very high resilient. You know, we are forged in high volume, high stress environments where we routinely manage every patient load, complex infectious disease, unpredictable medical emergencies. So when we work in this environment, we rarely burn out from fast-paced shift because we are used to it back home, which we otherwise overwhelm some of their domestic workers. We also have built-in cultural intelligence and empathy. Correct me if I'm wrong, African is home to thousands of ethnic groups and languages, very culturally diverse. So healthcare workers from across the continent, we are naturally bilingual. We can speak English language fluently alongside our local languages. You know, we even have some of the African speaking and French speaking countries in Africa as well. So we can navigate diverse cultural norms, family dynamics, communication barrier, which also allows these Western institutions to provide, you know, it sort of position us as the entity that can provide empathetic patient-centered care, because this Western settings values, you know, empathy, patient-centered care, inclusion and diversity. And we also have strong procedural and surgical autonomy. Due to staffing shortages at all, we some of the healthcare professionals, like even the junior doctors, they often perform advanced clinical procedures, you know, like complex wound management, they triage complex emergency triage decisions or specialized maneuvers, which sort of help them earlier in their career. It's sort of make them highly autonomous and confident and very confident on day one when they travel to another settings. And we have to address the challenges that is stalling us, because if we don't, we are going to be working in these countries as healthcare assistants. You know, I have nurses, doctors, because of the licensing and credential issues, they have to get their leg into the system and take on odd jobs. So it's sort of, we have to defeat brain waste. We also have to address these issues to break out of our economic stagnation. We all know that many African nations face a heartbreaking paradox. Like we have high unemployment, underemployment, you know, we don't get paid enough. So proactively clearing these licenses unlock global tier salaries. I think for me, especially, the best decisions I've ever made in my life is relocation. Relocation changed my life completely. Like the money I saved in just 3 years of relocation in the UK, I don't think I would have saved that working as a nurse 20 years in Nigeria. Yes. So relocation changes not only people's life, but their family's life, you invest back home as well. So it's an opportunity that can revolutionize not only personal life, but also even the economy of our country as well. So, and again, if we wait too long or we are not proactive when we lose these opportunities, it also makes us desperate to move to sort of become prime targets for predatory recruitment agencies. We have bad recruitment agencies that exploit desperation of candidates, locking them into illegal low paying contracts. So taking control of our own exams, of our own credential evaluation, we position us to negotiate from a position of power and choices. And I will close with saying that when I prepare for my UK registration after my Nigerian nursing registration, I thought that was the finish line for me, but it happens that it was not, because the habits that helped me register in the UK became the same habits that helped me pass my NCLEX, became the same habit that helped me become licensed in the United States. And as I'm now working towards my Canadian registration, that made me realize that I was not just preparing for one country, I was building an internationally transferable career. So for me, it makes me believe that international registration is a platform. It's not like a specific destination. So my advice to all of you here today would be to build a career that is internationally transferable. Another thing I would like to leave you with is many people spend years asking that which country should I move to? And I think that's the wrong question to ask. A better question is what kind of healthcare professionals am I becoming? Because country changes, immigration policy changes, healthcare systems evolve, but your competency travels with you, your integrity travels with you, your leadership skills travels with you, curiosity. So if you build yourself internationally, opportunities across the world will become available to you. So my advice again, don't just prepare for one country, prepare for a global career. And I wish you all the very best in your career. Feel free to follow me on LinkedIn. And thank you so much for listening to me.
All right. So thank you so much for that very informative presentation, Miss Faridat. And to all the nurses that are here, no, this is your time to ask our speakers some questions. And if you are joining from Zoom, just press the hands button or just chat your questions on the chat box. And if you are on our Facebook Live, you can share your questions in the comment section. Okay, so let's start. Okay, there's a question here, Miss Faridat.
Yeah.
Okay, so for the first questions from our audience is which destination currently has the highest demand for African nurses?
So the destination with highest demand of African nurses currently, I would say, is the United States, but also the UK as well. But again, it also depends. I believe that there are other destinations like the UAE, even Germany as well, is actively recruiting. So I would say you should just look at what you want. You should look at your short-term and your long-term career goals. What is available for you now? What resources do you have available? Which destination is easier for you to get your license in? I think that would also change the game for you. So the we have the US for sure, we have the UK for sure, but we also have other countries. So I would say do your own research, you know, based with your align with your research and your goals, then determine on which one you want to go for, which one can you easily get recruiters to sponsor you with if you have limited, funds. So put all of those things into consideration before you settle on a destination country. And just like I said, sometimes it does not matter the country that you start with, because you can always move. Once you get to that country, it becomes easier for you to move to your dream country.
All right, thank you for that answer, Miss Faridat. And another questions for you, Miss Faridat. No, what skills can make my application more competitive?
A good skill to have is to have a good resume and CV letter, because you are competing with different people, with sometimes even people with more experiences than you. So I would say you should tailor your application, like tailor each resume to one application. Go through, do your research, speak to people. If you already have people that are already working in these countries, to get as many information as you can get, continuously updating your skills. So while you are still waiting for your dream country, you should still be continue to upskill, upskill in digital technology, upskilling in your resume, update your resume, you know, continue to update your clinical experiences as well, especially if you can get acute clinical experiences. These are what most employer are prioritizing right now, that experiences in A&E, critical care, medical and surgical settings. So yeah, that's the message for me.
All right, so thank you for that answer, Miss Faridat. Actually, there's a question from Doc Akman.
Hi, Faridat. How are you?
I'm okay.
Yeah, I want to thank you for joining us, taking your time. Very educative, eye-opening uh, information, I think, especially for your continent, I should say. Also, now, as you said, we have a lot of demand from United States and Europe. But the challenge for the Europe, other than UK, let's say, is the language, right? So let's say in Germany, uh, there's a need, as you mentioned, hundreds of
Mhm,
thousands of medical professionals. However, uh, the requirement is B2 level German,
mhm,
right? Knowledge. So that is becoming the challenge. Do you know if the medical professional exporting countries in Africa, are they taking any, do they have any initiatives, government level or recruitment or universities level, any initiative to educate their students before, like start educating them, years ahead
mhm.
to teach German or French from for those countries they are interested in hiring, from Africa.
So I know that there are some initiatives that already exist. Maybe not in the African region. I'm familiar with, for example, the Canadian government. They have French speaking program to help people who want to relocate to Canada to get French proficiency. So there is also, even for Canada as well, you can also claim for, depending on the province. There are some provinces that have the package for you to claim for some money to help you prepare for your language or for your licensing. I know that that requirement is constantly changing, but for other countries like Germany, I'm not sure specifically um if they have government funded program to help. But for sure, I know that some recruitment agency also helps you with preparing for German. It's sort of the package that they give to you once you are registered with them. So what I would say is, to be honest, the language barrier is realistic. and I do understand that. But alongside some of these supports, there are also free resources online that you could also use to help you get your mastery in this language, at least the kind of mastery that you needed to pass the exams. So I would say to just continuously to start that process, because if you think that it's a big barrier, it's a big challenge, time is already going. Like, I would say just have like a plan for yourself. Look at what are the free available opportunities you could leverage on. I'm sure there are also some government funded programs, even for Germany. I'm not sure what exactly that is, but Canada has one for French, which is free. And for other countries with their respective language as well, you could research or even ask your recruitment agency or your, if you already have one, if there are resources that they could share with you as well. I hope I'm able to answer your question.
Thank you.
All right. Thank you for that, Miss Faridat. Actually, there's another question here on our Zoom, but I think this question is better answered by our licensing expert, Miss Connie, since this is a licensing question.
Okay.
Okay. So, are there other credential evaluation visa processing organizations other than True Merit, CGFNS?
Actually, yes, there are other organizations that provide credential evaluation services. However, it is very important to understand that not all credential evaluation organizations are accepted for nursing licensure or immigration purposes by every U.S. Board of Nursing. So, for internationally educated nurses, True Merit or formerly CGFNS International, so remains one of the most widely recognized and trusted organizations. So many US Board of Nursing specifically require or accept True Merit's credential evaluation and verification services. And True Merit is also the primary organization that offers the visa screen, credential assessment for registered nurses. Okay.
All right. Thank you for that, um, Miss Connie. Okay. Actually, there's a question here from the Zoom. Okay. So, I am from Cameroon, and the nursing licensing process is currently at a standstill. No nursing licenses have been issued for over a year. I took and passed the national licensing examination, but I have still not received my license because of an ongoing dispute between the Ministry of Public Health and the professional regulatory body. So, given this situation, what would you advise? Okay, would you like to answer this, Miss Faridat?
Hi. Yes. Sorry, I'm just going through the question again. So for this, what I would advise is I think something similar is also going on in, like, in Nigeria as well. Some of the For the past 2 to 3 years, some of the early career nurses could not progress because they couldn't get their licenses. So what I would I'm not I'm sure you could have I'm sure you must have tried some of this already, but I'll just say this. I will advise that you could contact the examination board and request like an official letter stating that you sat for the exams, like you passed it, and your license insurance is pending due to so reasons, which sort of becomes your proof of competency when you are trying to even get your leg or start the process. I know that might not help much, especially if you have to submit your some regulators have strict requirements. You have to submit that. But you could try this as well because it sort of helps explain that gap as you move ahead. What I would also advise you to do is while you are waiting for your license, because this is beyond your control, it's not something that you have a control over it's due to the administrative delay, is to start preparing for other exams like your English exams. If the UK is your destination or the US is your destination, you can start preparing for NCLEX or your CBT or your OSCE, whichever exams or countries you are going for. So try as much as possible to maximize these times that you are waiting. While you are still waiting, you could still look at what other thing can you get, can you start submitting why you are going, like why you are waiting for the license. Can you start preparing for your English exam, for example, and submit that? Do you have any other paperwork that you have to submit? Maybe like your transcript from your school. Can you start that process and submit that so that the next thing that is delaying you would be your license? By the time you are ready, you're ready even to progress to write your exams, start furnishing your CV, start gathering your clinical experiences. So I would say still start the process anyway, while maximizing all of this. Connect with your professional nursing association and union. I think that's what the Nigerian situations are currently using to help them push like a campaign out for the regulator to release their exams. They are working hand in hand with the professional nursing union body because they have the leverage with the ministry that you don't. So they might have the ability to advocate for you. So I know it is hard, to be honest. I know nurses myself that have been there, but I would say that you should continue to maximize that time while you wait, or even look at other options that you could get to that might not necessarily need that process. I'm not sure what that looks like, but that's also what you could explore. I'm not sure if that answers your question.
All right. So I think that's it for the Q&A portion with Miss Faridat. And thank you so much, Miss Faridat. But before you go, we want to give you something. It is our tradition to honor and award our guest speaker a certificate. So please accept our humble gifts. We present to Miss Faridat Ibidun a certificate of excellence for her exceptional contributions in healthcare and for the valuable insights she shared in this webinar. We are very blessed to have you joining our program and we hope to see you again soon. Okay?
Thank you so
S-
much. I'm very privileged to be invited, and I hope you are able to get some information from what I've shared or some lessons from my own personal journey. And yeah, thank you once again and enjoy the rest of your day, everyone.
All right. So our webinar is not over yet. Okay. Our next sessions are equally informative. After we understood from Miss Faridat why securing international licenses and early preparation are crucial for medical professionals in order to secure global opportunities. So the next session is about the preparation. And by the way, you can check our website for informative articles dedicated to African medical professionals. So if you want to know about or you want to know about our certain requirement for your country, check it out on our website www.medexamcenter.com. So our next session is one of the first steps for your international career, which is how to get your international license. So actually, this is the beginning of your journey to international opportunities. This one of the first requirements for countries like US and Canada, and you need to pass the NCLEX exam and of course get licensed. So to understand this most complicated process, here is our very own NCLEX licensing supervisor, Miss Connie, to explain more. Miss Connie?
Thank you, Trishelle. So, again, thank you, everyone, whether you are joining us from the Philippines, Africa, or any other part of the world. We are delighted to have you with us. So, we understand that applying for NCLEX can feel overwhelming, especially if it is your first time. So, that's why we are here to guide you every step of the application process. So by the end of this presentation, you'll have a better understanding of what the NCLEX is, how the application process works, and the documents you will need, and how NEAC can help you make your journey smoother and less stressful. So first, let's talk about what the NCLEX RN actually is. So the NCLEX RN stands for the National Council Licensure Examination for Registered Nurses. So it is the licensing examination that every aspiring registered nurse must pass before practicing nursing in the United States. So regardless of whether you completed your nursing education in the Philippines, Nigeria, Kenya, South Africa, or any other country, passing the NCLEX is one of the essential steps towards becoming licensed as a U.S. registered nurses. So this examination is developed by the National Council of States Board of Nursing and is recognized by all U.S. Board of Nursing. So passing the NCLEX does not automatically grant employment. Instead, it is one of the primary requirements to obtain a nursing license in the state where you applied. So the next question is, why should you apply for NCLEX, or why you become a U.S. registered nurse? So many nurses around the world pursue U.S. licensure because it provides excellent career opportunities. So working as a U.S. RN offers competitive salaries, comprehensive employment benefits, opportunities for career growth, exposure to advanced healthcare system, and access to various nursing facilities. For many nurses from the Philippines, African countries, Asia, Europe, and other regions, becoming a U.S. registered nurses is not only a professional achievement, but also an opportunity to build a better future, gain international experience, and support their families. So before we start the processing of your NCLEX application, we have some basic requirements that need to prepare for your application. So you need to have a valid passport, your nursing diploma, transcript of record where you graduated your nursing, copy of the related learning experience, local license in your country of education if applicable. So these are only the basic requirements before starting your NCLEX application. So let's talk about the Board of Nursing. So many of you are asking what is the easiest states to apply, but the better question is which state is the best fit for my qualification and career plans? Because not all states have the same requirements. Some states require credential evaluation, so they require English exam. They require the social security number, which you can only obtain once you are a U.S. resident. So when helping applicants choose a state, we consider several factors. So that includes the educational requirements or in your country of education. So your nursing curriculum, your future employment, processing time, overall application cost, and state-specific licensing requirements. So these are the popular state that most of the registered nurses applying when they want to take the NCLEX exam. So these are New York, Montana, and Illinois. And then once you choose your state, we will have the NCLEX processing. So let's go through the application process. So first, we need to complete the pre-eligibility assessment to determine the most suitable board of nursing for your qualification. And after that, we need to submit required documents. And submitting the required documents, there are some organizations involved, which is your nursing school that will provide your educational credentials, and your country's nursing regulatory authority that verifies your professional license. After they submit the documents to the Board of Nursing, then it will start to evaluate your application. So once approved, you will receive your eligibility. And after that, you need to register to Pearson VUE, which is the official testing provider for the NCLEX exam. Then, using your ATT, you're gonna schedule your examination at your prepared testing center, and there's nothing to worry because for NCLEX exam there are many testing center. Then after that, you will take the NCLEX examination. Then after you will receive your result and your license. So processing time. Many applicants is asking how long the processing of the application takes. So actually, there is no fixed timeline. So processing depends on the several factors that includes how quickly your schools submit your documents, processing by your country's licensing authority, Board of Nursing evaluation, credential evaluation if required, and then most importantly, the applicant's responsiveness in completing the requirements. Because the faster documents are completed and submitted to the Board of Nursing, the smoother the overall process usually becomes. But still, there are some instances that the application takes longer due to, because the approval of your application will still depend with the board's evaluator. And then, of course, before we start the processing of your application, there are some application fees involved. So typical expenses may include the Board of Nursing application, credential evaluation, if they are requiring, the Pearson VUE registration, document processing in your school and in the licensing authority in your country of education. Of course, courier fee, because all the documents that has been requested to your school and to the licensing authority should be forwarded directly to the Board of Nursing. And of course, service fee. So once your application has been processed, based on our experience, we have experienced some delays with the processing of their applications. Maybe because several organizations like the school, like the nursing school, they have their own processing time of the documents. So the local license validation processing delays, because some licensing authority receiving volume of applications or request documents, so There are some instances that we are receiving delays. And then Board of Nursing evaluation time. Because the approval of the application of the applicants still depends with their evaluator, and especially with the volume of applications that they are receiving every day. And then some common reasons of delays, of course, applicants is not responding to email requests, because there are times that we have some follow-up documents, or they have to comply with additional requirements. So if ever you need to be responsive to all your emails, you need to monitor it to comply with some lacking requirements. And then these are the tips in order for you to have a smooth application of starting your NCLEX application. So first, you need to submit your complete documents. And as I've said, mostly the delays are not responding to the emails. So you need to respond promptly to your emails, and keep your passport and local license valid, especially the passport, because the passport is the main requirement for you to take the NCLEX exam. So it should be valid, and it should always be updated. And of course, we need to follow all the instructions carefully. And then you need to inform your assigned licensing consultant of any changes to your information, so we can update you from time to time. And then, of course, this is the very important of having of getting your international license. Why choose NEAC to process your international license? NEAC medical exams application was founded by Dr. L.B. Ackman in year 2007 and was recognized as the world's first international medical exams application center. So we are pioneer in the international licensing application and provide specialized services to medical professionals anywhere in the world. With regard to medical exam, licensure application, assistance procedure. So what are the advantages of having any AC process your application? So we have a personalized guidance throughout your application from the initial up to getting your international license. So we have dedicated licensing consultants. We are continuously monitoring the application in order for our applicants not to lose track about the status of their application. So document verification before submission. So we do always checking before the documents to be forwarded to the organization in the US. So regular progress updates, assistance with the Board of Nursing requirements, support our applicants until exam scheduling. So we also have a virtual support that available for the applicants concerned. So you can have a face-to-face video conference with your assigned licensing consultant. So we have experienced team handling international applications. So these are the countries that NEAC assists with exam licensing application. Of course, we have the USA, Australia, Canada, New Zealand, UK, Ireland, Saudi Arabia, then Philippines, Qatar, UAE, Oman, and Bahrain. So here in NEAC, as a world leader in medical licensing assistance, our commitment is to making your NCLEX application process simple, organized, and stress-free. So our goal is to help you achieve your dream of becoming a US registered nurse through professional guidance and reliable support every step of the way. And so now, That's the end or concludes of my presentation. So thank you very much for your time and participation today. So we hope this orientation has given you a clear understanding of the NCLEX application process and what to expect throughout your journey. On behalf of the NEAC Medical Exams Application Center, we look forward to assisting you every step of the way until you achieve your goal of becoming a USR registered nurses. So that's it. Back to you, Trishelle.
All right. So thank you for that very informative presentation, Miss Connie. And now, of course, an English exam certificate is one of the requirements for medical professionals who wants to work in English-speaking countries such as the USA, the United Kingdom, New Zealand, and Australia. A lot of nurses are confused which of the English exams give you more advantage. Is it IELTS, TOEFL, or OET? So to understand better which test gives you more opportunities, let's hear it from our OET education specialist, Miss May Sevilla Miklat. Miss May?
Hi, sir. Hi,
Hi,
can you
Miss
see
May.
me?
Yes po.
Hi. Nice to have you, and it's an opportunity actually to be here with NEAC. I heard lots of good things from the two speakers that we had a while ago. So thank you so much for giving us the opportunity to present what OET is and how OET can be helpful to our healthcare professionals. And to do that, I will now be sharing my screen so everybody can now see my presentation. And tell me, sir, Trishelle, if you can see it now. All right.
All right, Miss May.
Thank you so much. There you go. Right. It's now presenting. Correct? Can you see it
Yeah.
now?
Miss May, we see you are starting to share your screen, but there's no
Okay.
power.
And now you
Yeah,
can
yeah,
see my first slide, right?
yeah. I can see it now.
Thank you so much, Sir Trishelle, for confirming once again. Good afternoon to our participants. Good afternoon to our health professionals, not only here in the Philippines, but those that are spread all over the world. In Filipino, we say, "Kumusta po kayo?" And in English, it means, "How are you?" And wherever you are in the globe, I hope that you are all well and you are all ready to listen what OET is all about. So I'm very proud to represent OET, the preferred choice for healthcare professionals. And these are the things that I will be discussing. Definitely a short introduction of OET. Why should we choosing OET among other and many English tests? Like what Sir Rachel said a while ago, what is waiting for you beyond BCSP, one test, the OET test, and what value can it give you? And how can Filipino candidates, not just Filipino, other candidates all over the world can prepare for OET? First, OET is not like your usual healthcare, not your usual English test because it's uniquely tailored for healthcare professionals. That means the test, it tests your English skills, your proficiency in listening, speaking, reading, and writing, but the context will not be everything under the sun. The context is about healthcare. So for example, for listening, you will be having consultations, you will be listening to them, and you will be filling in information. And this information is from what you've just listened to from the consultations, patient to healthcare professional consultations. And I will explore that later on, but I just like to emphasize that OET uses the settings, the context that you are very used to every day. That's why it provides a valid and fairer assessment of your English speaking, because we're not just testing your English using random topics. We're using context that you are very much familiar to and that you use in the workplace. I know you've been preparing to be healthcare professionals in your bachelor's, and now that you are professionals, experience really means a lot to be confident in what you know and how you will be moving and how you can really show your competency here. There's English, but the context is very much what you are used to, what you do every day. So it's not just fairer, it's not just more valid, but I know it's very relevant to you, so you can be confident taking this English test. And what's also good, and I'm very proud to say, is that OET is accepted by regulators and health organizations worldwide. And who are they? You can see here the many organizations all over the world that accept OET. So we're accepted by GMC in the UK, NMC also in the UK. We also have APRA and ANMAC from Australia, ECFMG in the United States of America, and Federation of Medical Regulatory Authorities of Canada. In addition, we're also accepted by healthcare regulators from New Zealand, Ireland, Singapore, and Dubai. Now, if you know what states what states from the US accept OET, here is a map to illustrate that. So you can see here states that are colored in blue, and these states accept OET. So we're now starting. It's just a few states that we haven't yet that don't accept OET yet, but our colleagues from the United States are really working hard to make this happen. But as you can see, they're almost filling this out, the map and the states of the United States. So you can assure that your OET test, your results will be valid in different countries as well as different states in the US. Now, if you are curious who takes the OET test, because now you know that it's specific to healthcare professionals, what healthcare professions have a specific OET test in. So you can see that here in the slide. So it's not just for nursing, it's not just for doctors. There's a specific test for dentists, for dietitians, for occupational therapists, optometrists, pharmacists, physiotherapists, podiatrists, radiographers, and speech pathologists, and veterinarians. So you can see all the top professions here that have a specific OET test in. Okay, now, how to take the OET test? So we have three platforms, but usually it's computer and on paper. So good thing about this is that on OET in computer, your results, if you take your OET test in computer, you can receive your results as early as 2 days. Especially for those who have a very tight deadline, you can choose OET test on computer. It's available Mondays to Saturdays. So if you want a more flexible way of testing, more modern tool, and a faster way of receiving your results, then OET test on computer is the right test format for you. Now, if you are more on the traditional test taker, you want the feel of paper when testing. I am like that, and I'm slowly, getting used to having my test on computer since we are living in a more modern world. There's also an OET test on paper for you. So here, the test will be on Saturdays, and your results will be available to you as early as 5 days because it's paper-based. So we need more time to check the answers. So it would need more time compared to your computer-based test results. But we are ensuring that both are valid, both are fairer way of testing your English tests. For more information, you can visit our website. That's oet.com. You can click the tab there, ready, and for you to see other test venues. But here in the Philippines, these are the test locations where you can sit for your OET test. So we have several and many locations in Luzon, Visayas, and Mindanao. And you can see here two icons. If you see the paper icon, that means the test location is catering paper-based tests, computer-based tests. And if you can see both of the icons, that means that location has both of these test formats. So Luzon, Visayas, and Mindanao. For example, in Makati, we both have a test venue there that caters to those who want to take their OET on paper, and for those who want to have a more modern feel of their test, computer-based test. I just want to illustrate better how OET is different from other general or academic English tests, because right now you might be thinking, okay, OET is specific, but how is it how is really different? How is really specific? What is the finer detail here? Now you can see, for example, for writing speaking, because like what I shared, it has 4 subtests: listening, speaking, reading, writing. For listening and reading, all healthcare professionals would be tested on a general healthcare settings, but it would be different for speaking and writing because the context will be specific on your profession. Okay, so for writing, other English tests will be asking you to write a letter essay on a general topic. So it can be, for example, I met a healthcare professional and he was asked to write about aliens, horticulture, gardening, and he is a nurse. He is not fond of planting. He's not fond of trees. He doesn't have a green thumb. So he was very lost how he can really write an essay. But here, as a healthcare professional, your writing test, you will be asked to write a healthcare correspondence, a referral letter, discharge or transfer letter based on case notes. Very relevant, right? Now, for speaking, it's a structured interview on a general topic. How's your day? What are your plans in the next 5 years? Something like that. What is your opinion about this topic? But for speaking, there will be 2 role plays. Your interlocutor or interviewer. For some English tests, they call them interviewer, but now for here, it's interlocutor. For OET, your interlocutor will not assess you. So there are different assessors who will be evaluating you, how you performed in your role plays. Again, 2 role plays, and the context will be a consultation or a visit in the clinic, right? Very familiar also to what you do every day. Now, the test format is like this: listening, speaking, reading, writing. So listening 40 minutes, 42 questions, 3 parts, A, B, and C there. Now, the context will be, again, consultation, workplace communication, and then professional development. The same context for reading, but you have 60 minutes here, an hour, you have 42 questions. For writing and speaking, which question specific, for writing, you have 45 minutes. 5 minutes will be used for reading time, 40 minutes will be if you write your letter. Again, it can be discharge, referral, or transfer. Speaking, 20 minutes. Each role play will be 5 minutes. And for each role play, you have a preparation time of 5 minutes. And for that, before each preparation and role play happen, you have also a preparation time. You and your interlocutor will be talking to be more comfortable, and you have that warm up to put you in the right mindset and frame so you can be readier and focused when you sit for your 2 role plays. Now, moving on, how you would be using your OET test. If you have gotten or you have already received your OET test results. So for those candidates who are very interested to be in the US, so beyond visa screen, we know that OET is not simply an English test requirement, because since OET is using the context that you're very much familiar to, healthcare context, workplace communication, you're tested on the communication that you are supposed to show, or you are supposed to utilize and use in the workplace. So that means when you step in your work day one, you're ready. You have greater confidence to communicate with your workmates, with your colleagues, with the family of your patients, and more importantly, your patients. And when we are confident, we're not shying away to talk. Definitely, there are fewer communication related errors. So you're not just confident to communicate, you are more confident to do your job. So I think those are two separate things: confident in communicating and confident in doing your job. But they're related to each other. Don't you agree? And if there are fewer communication errors, there are safer patient interactions because of your confidence in communication and in doing your job. And because of that, there's faster workplace integration. I know it's not easy to be an internationally educated nurse working in a different environment. So you also have to consider how you're going to integrate yourself. So if you feel confident talking, communicating, you feel confident doing your job, so you're more confident in yourself that you are that you can do your job, can integrate yourself in the workplace, you can immerse yourself in all the aspects of living in the country where you choose to work. And that's those are just some of the benefits of thinking that OET is not just your English test, your simple English test, but it really readies you for the real thing, for the real job, for the aspects that are waiting for you as you choose your career globally. Now, like just to sum everything up, so one test, great value, save time and money because you're taking a test that is right for you, relevant for you, so you will be lessening the chance of many retakes. Now, in terms of retake, there is no limit on how many times you can take the OET test, but certainly we want to save money. We want to save time and effort, and we don't want to sit for a test again and again. So choose for a test that you will be confident in, that is relevant for you, and you know that fits really for you like a glove. So a test also that prepares you for work, like what I said, you want a test that will not just test your proficiency, but also readies you for work. So those are two things, two different set of things that you can get if you will be choosing OET. Now, achieve results faster, again, as early as 6 days for paper-based test and 2 days for computer-based test. Now, in terms of preparation, here is statistics. So I kind of like buckle on that, but 56% of Filipino candidates pass on their first try. Okay, so 56%. Now, it really depends. There are so many factors here, but the guarantee is like 6 out of 10 Filipinos can pass on their first try. It still is, this one is a result of many factors, whether they self-prepare, what's their language proficiency, how much time they devote on studying, what materials that they use when they are studying or preparing for OET. But again, nice to know that 6 out of 10 Filipino candidates, healthcare professionals who took the OET, passed their OET test on their first time sitting for it. Now, 2 out of 3 Filipino test takers prepare for less than 8 weeks. So I know healthcare professionals' time, very precious. So most of them prepare for 8 weeks or 2 months, and 2 out of 3 really pass their OET. Okay, and the last one, Filipino candidates achieve goals at the same pace at global peers. So our Filipino audience might be curious, okay, because English might not be my first language. I think I will not be, I need more time to prepare. But as you can see here, based on statistics, Filipino candidates really just get the same results with the same pace as global peers. So it doesn't really matter as long as you know how to begin, what resources to use, and what are the steps for you to achieve your global future. That's why we have lots of resources in our website. So many of them are free and some of them are paid. So we have sample tests for all sub-tests: listening, speaking, reading, writing. Again, that's oet.com. That you can visit as I am talking. So you can see the many materials that are waiting for you. We also have the OET test study guide, so you know what the OET test has and how to really prepare for them. Writing and speaking guides, the criteria definitely you want because you will be performing. Performing in a sense that you will be writing a letter for writing. Performing in a sense that you will have role plays. What are the sets of criteria that you will be using or that you need to know so you know that you can get your target scores? We also have that. We have test taking tips, especially how you can make sure that you are actively listening, how can you apply critical reading skills for the reading subtest, how you are writing with purpose, succinctness, and how you are writing effectively. We also have blogs for that. Speaking, how can you structure your speaking, how you can make sure that you are really using clinical communication in your role play. We also have that for you. We also have information sessions like this, Q&A on our pages. We also have mini courses, but I think this is paid. But we also have OET lessons and master classes. And here's an addition. If you book your OET test, you will be getting details on how you can join our preparation workshop for all subtests: listening, speaking, reading, writing, and that is for free. Preparation workshop, once you book your OET test, whether that's computer or paper-based test. And then you can also have a chance to book for a one-on-one. So if you feel that you want to have a more personalized guidance on taking your test, we also have that, especially here in the Philippines. Now, I know that you want to have more resources and to find more information about OET. So here's a free resource for you from us. You can scan the QR code that you can see on the screen now. And yeah, it's downloadable, it's interactive, so you can start your OET journey. Now, we also have the ultimate guide to OET writing because most of our candidates are very much afraid and anxious about their writing. So we have the ultimate guide for that, also for speaking. And you can find that in our website too. Once again, oet.com. Speaking samples, if you want to know, how do I achieve my target score? How do I observe, or how do I make sure that my performance on the test day will be based or will be getting the target score that I want? So we have the graded writing and speaking samples. Again, these are available on our website. Now, we are also talking about integration, right? So we have destination guides to these popular places for our internationally educated nurses. So USA, UK, Canada, Australia, and New Zealand. So how to get them? Lots of free stuff here. Please scan the QR code that you can see on the screen. Okay, so I am nearing my presentation, but for you to stay connected, especially for our Filipino candidates, you can follow us on Facebook. That's OET Official PH. Scan the QR code, or please search in the search bar OET Philippines. And to know more of the wider announcements in different regions: Africa, Europe, UK, US, India, and other parts of the world, we also have our global pages, and you can reach them or access them using the QR code that you can see on the right side of your screen. Okay, so I think that's the end slide. Thank you so much for having us once again, NEAC. It's an opportunity for us, good opportunity for us to share something about OET. And I hope our internationally educated nurses, our healthcare professionals, will be having an easier journey of achieving their global dreams and career. Once again, my name is Macy Villa Miklat, and I'll hand it over back again to Sir Trishelle. Sir Trishelle?
Okay, so thank you for that very informative presentation, Miss May, and of course, Miss Connie. So if you have questions about OET and NCLEX application, this is the segment where you can ask our speakers directly. Okay,
Mm-hmm.
so let's see what are the questions on our Facebook and Zoom. Okay, so there's a first question for OET. Okay,
Mm-hmm.
so how many times can I retake the OET if I don't achieve the required score?
Right. Thank you so much for that question. And I think that's an interesting one. Like what I said, there's no limit in the number of takes you can take your OET test, but we want to save money, we want to save time and effort. And I think as a healthcare professional, you want a test that is specific for you, relevant for you, and that tests your knowledge and competency at the same time testing your English skills. So to answer that, sir, no limit.
All right, another follow-up question for Miss May. How long does it take to receive OET results?
Okay, so for your OET test results for computer, it's usually 2 days. Now for paper-based test, it's 6 days. But for some instances, or especially for computer, they receive it as early as 1 day.
All right, so thank you for that answers, Miss
Mm-hmm.
May. And we have a question for NEAC for us, no? For Miss Connie. What are the first steps to becoming internationally licensed?
Okay. So the first step to becoming an internationally licensed registered nurses is to identify first the country or state where you want or you intend to practice. Because each country, just like in the United States or in the US, each state has its own nursing regulatory authority and licensing requirements. So choosing your destination first ensures that you follow the correct application process and avoid unnecessary expenses or delay with the processing of your application. And it also helps you understand the specific eligibility requirements, and estimated processing time, of course, and then associated, or I mean the application fees, allowing you to avoid unnecessary or avoid mistakes of submitting application. So it's better to understand first or think first in which country you want to apply for your international license. Okay?
All right, thank you for that, Miss Connie. Actually, a follow-up question. How can NEAC help me throughout the licensing process?
Okay. So here in NEAC, we guide applicants from the very beginning by helping them choose the most suitable state or country based on their qualifications and career goals. So we also assist with the document preparation, um, pre-qualification, so credential evaluation, coordination if it is required, and then Board of Nursing applications, NCLEX registration. So making the licensing process smoother and more organized. So this step-by-step guidance help applicants to avoid common mistakes and ensures they meet the requirements of their chosen nursing regulatory authority as efficiently as possible.
All right, so thank you for that answers, Miss Connie and
Thank
Miss May.
you.
Okay, so right now you can now talk to our licensing consultants directly by scanning the QR code that you see on your screen. Ayan. Ayan. So, or you can click the link on the pinned comment section on our Facebook page chat box. Okay? So, please take note of the secret code that displayed on your screen. So, this code is exclusive to our live attendees and can be used to claim your special reward and receive a stamp on your NEAC Roadmap Passport. So be sure to save the code or take a quick screenshot before it disappears. Okay, so don't forget also to follow our official social media pages for future webinars, career updates, licensing tips, and upcoming programs. We have also have a company offices in the USA, Manila, Cebu, Singapore, Germany, and Dubai. You can also contact us through our website that you see in our screen, and you can also visit our office here in Manila. Okay, so thank you once again to everyone who joined us tonight or for this special NEAC webinar. So we hope that today's discussion gave you valuable insights, clarity, and inspiration as you continue pursuing your international healthcare career goals. At NEAC, we remain committed to helping healthcare professionals navigate global opportunities with the right guidance, education, and support. So at NEAC, again, we are the world leader in medical licensing assistance. So goodbye, everyone, and we look forward to seeing you again in our next webinar.